The impact of stress on your immune system, what you need to know. Stress is a normal reaction to the difficulties of life, but when it persists over an extended period of time, it can seriously impair your immune system. Maintaining general health requires an understanding of the connection between stress and immune function. In this video, we will highlight 7 key points to help you grasp how stress impacts your immune system and what you can do to mitigate its effects. Number 7. Cortisol production. When the brain senses danger, the hypothalamic-pituitary-adrenal axis is activated, starting the body's reaction to stress. The pituitary gland produces adrenocorticotropic hormone in response to the hypothalamus release of corticotrophin-releasing hormone, which starts this cascade. The glucocorticoid hormone cortisol, which is essential to the body's stress response, is subsequently released by the adrenal glands in reaction to ATH. By improving cardiovascular function, regulating immunological responses to avoid excessive inflammation, and increasing glucose availability for energy, cortisol helps prime the body for quick action in acute conditions. However, cortisol levels can stay high for extended periods of time when stress turns into a chronic condition brought on by recurring life stresses, including relationship problems, work expectations, or unstable finances. By preventing lymphocytes and other immune cells, especially T cells and B cells, from producing and functioning, a prolonged increase in cortisol can result in immunological suppression. This suppression can make people more vulnerable to illnesses like the flu and colds and impairs the body's capacity to fight off infections. A person's happiness in general might be further complicated by a series of health problems that can result from persistently elevated cortisol levels, such as weight gain, hypertension, and metabolic syndrome. Number 6. Impact on lymphocytes. T cells and B cells, which make up the majority of lymphocytes and have different but complementary functions in immunological defense, are essential parts of the adaptive immune system. While B cells create antibodies that kill pathogens, T cells are in charge of locating and eliminating malignant or contaminated cells. It has been demonstrated that long-term stress adversely affects these cells' number and functionality. According to research, long-term stress can cause the thymus gland to produce fewer T cells and hinder their capacity to multiply in response to antigens. Chronic stress can specifically change the ratio of one type of T cell to another, for example. It may encourage a rise in regulatory T cells, which suppress immunological function, while decreasing cytotoxic T cells, which are vital for battling infections. Stress can also affect B cell activity, which can result in a reduced humoral immune response and less antibody production. Studies have shown that because of this impaired lymphocyte activity, those who are under a lot of stress have a higher chance of getting sick after being exposed to viruses. Furthermore, the body's capacity to generate effective defenses against cancer cells is hampered by this decrease in lymphocyte activity, which may permit the development or progression of malignancies in addition to making people more vulnerable to infections. Number 5. Inflammation and disease. Understanding the connection between inflammation and chronic stress is essential to comprehending how it affects general health. Acute stress can set off healthy inflammatory reactions that aid in the healing of wounds or the fight against infections. But chronic stress results in a persistent low-grade inflammatory state marked by an excess of pro-inflammatory cytokines like tumor necrosis factor alpha and interleukin-6. Chronic inflammation is harmful and has been linked to a number of illnesses, such as metabolic disorders like obesity and type 2 diabetes, cardiovascular diseases like heart attacks and strokes, and autoimmune diseases where the immune system attacks healthy tissues by mistake. Chronically high blood levels of inflammatory markers can harm blood vessels, encourage artery-clogging plaque, and interfere with metabolic functions. Elevated IL-6 levels, for instance, have been connected to increased insulin resistance, which is a component of metabolic syndrome, a group of disorders that raises the risk of diabetes and heart disease. Furthermore, mental health conditions like anxiety and depression are linked to chronic inflammation. Inflammatory cytokines can affect the neurotransmitter systems that regulate mood. This results in a vicious cycle whereby psychological anguish makes physical health problems worse, which in turn causes more inflammation. This cycle emphasizes how critical it is to treat mental and physical health holistically. Number 4. Mental health connection. Stress and mental health have a complex and wide-ranging relationship. A number of mental health conditions, including anxiety disorders, depression, and post-traumatic stress disorder, can be brought on by prolonged stress. These disorders frequently result from extended exposure to stimuli, but they can also be caused by negative thought patterns and emotional upheaval. The HPA axis is commonly dysregulated in those who suffer from anxiety or depression. This dysregulation leads to aberrant cortisol levels, which in turn cause inflammation all over the body. In addition to disrupting emotional control, elevated cortisol can impair cognitive abilities like memory and decision-making, sending people into a downward loop where stress-induced physiological changes worsen their mental health. Furthermore, people with mental health illnesses may resort to unhealthy coping mechanisms like substance misuse or social disengagement, which weakens their immune systems by lowering the social support systems necessary for emotional resilience. Immunity and mental health are correlated in both directions. Chronic illness can worsen depressive or anxious symptoms, while poor mental health can impair immunological responses. This cycle emphasizes how crucial it is to use integrated therapy approaches to address both physical and psychological health at the same time. Number 3. Stress and recovery. It is impossible to overestimate how much chronic stress affects people's ability to recover from disease or injury. It has a big impact on how well people recover from physical conditions or procedures. The body's resources gradually run out when a person experiences persistent stresses, whether they are physical, like chronic pain, or emotional, like sadness or anxiety, as a result of the HPA axis being continuously activated. Stress hormones such as cortisol reduce inflammatory responses that are essential for tissue regeneration and repair, hence impeding important components of the healing process. For instance, a healthy immune system is crucial for preventing infections and promoting healing through inflammatory mechanisms that encourage cell regeneration during the recuperation period following surgery or a serious illness. However, because chronic stress impairs immune function, people may take much longer to recover from surgery. Research indicates that patients who are under stress have higher rates of postoperative problems than their counterparts who are not under stress. Number 2. Lifestyle factors. Effective stress management is essential for immune system function and general well-being. A number of lifestyle changes have been demonstrated to lower cortisol levels while boosting resistance to stress. By encouraging people to concentrate on present moment awareness rather than dwelling on past or future concerns, mindfulness techniques like meditation have been shown to improve emotional regulation, cognitive flexibility, and cortisol levels. This lowers anxiety levels linked to chronic stressors. Another effective strategy is regular exercise. It not only increases endorphins, which are naturally occurring mood enhancers, but it also improves circulation and strengthens the immune system by promoting lymphatic flow, which helps the body rid itself of pollutants. Recovery depends on getting enough sleep. The body goes through important repair processes during deep sleep, which strengthens the immune system by promoting the generation of cytokines that are needed to fight infections. Number 1. Individual variability. Individual differences in the impact of stress on immunity can be attributed to a variety of factors, including personality qualities, age-related factors, genetic predispositions, pre-existing medical disorders, and coping mechanisms used during stressful situations. Certain polymorphisms in genes linked to cortisol metabolism, for instance, may confer greater resilience against stress-induced immune dysfunction, while others may predispose individuals toward heightened sensitivity to stressors, leading to more severe outcomes when faced with chronic pressure situations like job loss or relationship breakdowns. Genetic factors may also influence how effectively an individual regulates cortisol production or responds to inflammatory signals. Age also matters. Immunosenescence, a progressive deterioration in immune function, is common in older persons, making them more susceptible to chronic inflammatory disorders and infectious diseases when exposed to high levels of stress for extended periods of time. In order to customize therapies meant to improve mental health resilience and support optimal functioning during times when both psychological and physical systems are under increased strain, if you liked our video, please hit the like button and subscribe to our YouTube channel.